Hello, everyone, and welcome to today's Triple Tree Thought Leadership session. Before we get started, I would like to go over a few items to help you get the most out of today's session. You have joined the presentation listening using your computer's speaker system by default. If you would prefer to join over the telephone, just select Telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's panelists by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will address questions throughout today's discussion. I would now like to introduce Michael Carroll.
Good morning, everybody, and welcome to today's Market Insights live session. Today's session is focused on the 4 companies that were recently announced as winners of the Triple Tree iAwards. And we'll highlight those organizations and the impact that they are having across healthcare. Our panelists today bring their perspectives as entrepreneurs, CEOs, medical doctors, and founders. A reminder that today's session and the opinions that are expressed today are those of our panelists and do not necessarily reflect those of Triple Tree or its affiliates. To begin today's session, let's spend a few minutes talking about why innovation is still important in healthcare. Lori, please advance the slide. So obviously 2020 has been a transformative year across our industry as new technologies and capabilities were deployed to respond to the COVID-19 pandemic. As we think about innovation, it's important to think about those long-standing pain points that have impacted healthcare for a long time. You think about the costs and the need to control those costs, whether you are a payer, a provider, or a consumer. You think about quality and the need to actually deliver a more consistent healthcare experience and improve outcomes regardless of where you were born, the color of your skin, where you live, and where you received care. And finally, we think about innovation in those capabilities that are improving the effectiveness of our healthcare system. In a system that has a supply and demand problem where we have more demand and not enough folks to actually deliver the care that's necessary, we're overly complicated, and unfortunately in our country, we actually deliver suboptimal care relative to other countries. Next slide. So where do we think about innovation and how do we think about those capabilities that are making the healthcare system better? As Triple Tree, as a merchant bank focused in healthcare services and healthcare technology, we think about this $2.5 trillion sector, and more importantly, the interplay and blurring of traditional healthcare services and healthcare technology, as those are the capabilities that are going to actually change how healthcare is delivered, how it's experienced. It'll help reduce the fragmentation of our system, and it'll provide those capabilities to actually allow the system to operate more efficiently. Next slide. And so as we reflect back on the iAwards and we think about innovation that has occurred over the last decade plus, we've been proud to recognize companies over the last decade, and particularly, here's a sample of organizations that have been previous winners of the iAwards. And you see organizations that are blurring the line between healthcare and retail. You think about companies that are creating price transparency in prescription drugs, and you think about companies that are creating those new administrative capabilities that are changing how our system works. And we're thrilled to announce today the 4 winners of the 2020 iAwards program on the next slide. So this year, as we recognize the iAwards, you can go ahead to the next slide. So this year, as we recognize the winners of the iAwards, we're pleased to announce 4 companies that have won against 2 categories: solutions that improve healthcare for consumers, and we're thrilled to announce that SilverCloud and Twistle are the winners of this year's award, and solutions that improve how healthcare works, and we're proud to announce that Clearwave and Virata Health are the winners of this year's award. So to begin today, I'd actually like to turn this over to my colleague, Ryan Engel, who's a partner at TT Capital Partners.
Thank you, Michael. Good morning, and welcome to Market Insights Live. Today is the 8th and final of 2020 installment of our thought leadership sessions that we've been bringing to you throughout the fall. We really hope that you've been enjoying the series. Today's discussion will focus on an important topic in healthcare: innovation that is driving impact. 2020 has demonstrated the resiliency and responsiveness of the healthcare industry as it has implemented and onboarded new capabilities to respond to the demands of the pandemic. We are fortunate to be joined by 4 leaders from innovative companies that were recently recognized as winners of the Triple Tree Eye Awards. I will introduce these 4 leaders in turn, starting with Ken Cahill. Ken is the CEO and co-founder of SilverCloud Health. SilverCloud is the world's leading digital mental health platform. It enables the delivery of clinically validated digital therapeutic care programs that are proven to significantly improve clinical outcomes, increase access and scale, while reducing costs of care delivery. Next, I'll introduce Mike Lamb, the CEO of Clearwave Corporation. Clearwave reduces patient and staff workload, provides excellent patient experience, and accelerates revenue collection. Mike brings a strong background of executive leadership in technology and digital healthcare to his role at Clearwave. He spent more than 20 years at ADP in senior sales and operation leadership across major and global client segments, followed by 7 years as COO and then CEO of Vivere Simplywell, an employer wellness company. Next, I'll introduce Kulmeet Singh, the CEO and founder of Twistle. Twistle uses secure, patient-centric communication to drive care plan and protocol adherence, improve outcomes, and lower costs. Kulmeet previously founded MedRemote, which leveraged speech recognition and machine learning to change the economics of physician documentation and medical transcription that was purchased by Nuance Communications. Kulmeet's success is rooted in his commitment to a patient-first philosophy, which prioritizes decision-making based upon the best interests of the patient. And finally, I'm pleased to present Dr. Yiding Yu, the Chief Medical Officer of Virata Health, which is now a part of Olive. Virata Health is used by thousands of physicians to automate prior authorizations for advanced imaging, surgeries and procedures, and specialty drugs, dramatically reducing staff burnout and streamlining the revenue cycle. As a serial entrepreneur, Dr. Yu was honored by the Cartier Women's Initiative Awards as Woman Entrepreneur of the Year in 2018. She has won top innovation prizes from the American Heart Association, the American Medical Association, and the Cleveland Clinic for her groundbreaking work. I'm pleased to welcome our 4 panelists to the discussion and looking forward to digging in.
Hey, Ryan, before you jump in, just a reminder to our attendees today, if you'd like to ask questions throughout today's discussion, you can actually ask a question via the question bar on the GoToWebinar panel, and then we'll weave those into our discussion as we go through today. Thanks.
Our first topic is around innovation spark. You have to know how healthcare works or doesn't to find those pain points to innovate around. What was the spark insight that created the vision for your company? Let's start with Ken. Ken, you're on mute.
Apologies. The phrase that pays this year in 2020, right? Thank you very much for the opportunity to speak here today on this panel. Yeah, I mean, innovation is still an important part of what we do. In terms of the sort of originating spark, we'll be looking at some of the challenges that were there. So in the digital delivery of mental health or behavioral health access, existing solutions really kind of fell short on kind of 3 areas. limited patient engagement, high patient dropout, and limited clinical improvement. So essentially what was happening was existing solutions may work in a laboratory situation, but when they were actually deployed into the real world, they fell short. They fell short from a clinician's perspective and then from the patient's perspective. So we worked on that as a team for a little over 15, 16 years, but that was, I suppose, the gem of the spark.
That's great. Kumit, how about you with Twistle?
Yeah, so thanks for the opportunity. I think Twistle started, this was after I was concluding my stint at Nuance as an executive. In my own personal interactions with physicians, both for my own care and my family's care, there were a handful of them back then who would just give you your phone number and their mobile number, and they would text with you. And it was just a great experience having access to docs. It was also unrealistic to think that could be done at scale. I come from a physician family, and so I had access to physicians that would text with me that they probably wouldn't do with all their patients. So how do you do that at scale? And the other thing that we saw was that a lot of these interactions had the same consistent pattern over and over again. And so when you see patterns, you think machine learning, you think automation. And so our founding team had come from successful ventures in speech rec and in natural language processing. So it was a good fit. How can we automate these? These are effectively care plans. If you look at a conversation thread between a care team and a patient, it's effectively a care plan managing the patient at home. And so our goal was to automate such care plans at scale for large populations. And there was an observation that Mike just made. There's a disconnect between there's a growing population and not enough clinicians. And so that's another thing. How can you deliver effective care? How can you get patients activated in their own care, which is a prerequisite to get to a good outcome now. And so that was also part of the thinking, that if we can automate care plans at scale, we will be able to sort of change healthcare. That remains an ambition.
That's great. How about you, Dr. Yu, with Virata?
Thank you, and thank you so much for having us. It's such a pleasure to be here and share our story. So, I'm a physician, and Virata was founded by a physician-led team, and so much of the problems that we saw were the barriers that were holding our ability to deliver good care and timely care to our patients. And prior authorization, frankly, remains the #1 preventable reason for delays in care. It just is an administrative process where you need to have insurance approval and prove that it's medically necessary to get care, but care could be delayed for days or even weeks when you are stuck in a paperwork or faxing process. And so the other challenge that we saw was that not only was it a frustrating and burdensome experience for ourselves as physicians, but also for our patients who are struggling to wait for their cancer care or to get, that critical MRI. But financially, it was hurting healthcare organizations significantly. Prior authorizations actually accounts for about 1/3 of all preventable write-offs for a health system. And so you think about that, right? How much, when margins are only at the 1%, 2%, 3%, if you can bring back about 30% of those write-offs or prevent them entirely, it could have transformative changes and allow health systems to reinvest that money towards patient care. And so that really is where the inspiration to start Virata came from. And then when we set out to say, well, what's already available? Because prior authorization is not a new problem. Why hasn't it been solved? It seemed that a lot of solutions were focused on automating maybe a point of the problem. They could help organize your work. They could maybe pull back a status check. But the bulk of the work of finding clinical documentation, trying to track all those rules from insurance companies, that was still squarely on the backs of providers and their staff. And so ultimately, we set out to say, let's transform that process. Let's solve and provide an end-to-end solution with 3 tenets in mind. Both our CEO Jeremy and myself, worked at very large, multi-billion-dollar healthcare organizations, and we know that, number one, those organizations don't want to change the clinical workflow. We need to get out of the way of the doctor-patient experience, and we can't create technology that says you've got to change or try to, alter people's paths. We want medicine to lead first. But second, an organization like Mayo Clinic or mine at Atrius Health, we don't want to buy a software that only works for radiology and then buy a different bolt-on for orthopedics. We want a solution that works across all of my service lines. And then third, we need a solution that's not just I go to one website for Blue Cross and another website for Cigna, which is really the landscape that we see now, and then why it's so disjointed. And so we set out to solve this problem for all payers, and that's really the philosophy of where we came from and how we set off to solve our problems.
That's super. Thanks for sharing. Let's wrap up with Mike at Clearwave.
Well, thanks, Ryan, and likewise, really appreciate the chance to be on this panel today. And there's really 2 kind of distinct sparks in the Clearwave story that both happened around the same time in 2005, 2006, about 7,000 miles away. So Clearwave was the spark for Clearwave was our initial founders, were checking in to get on a flight at a kiosk back in the mid 2000s, which just started to, as you might recall, take shape in automating the airline check-in experience. And they both had healthcare administrative and technology backgrounds, and they thought, why can we check in for a flight this easily, and yet when I go to the doctor, I have to deal with a mass of clipboards and forms and papers, and it takes 20 minutes, to check in, just really inefficient. And that was literally the spark, moving, from a trip to how can we take this same approach and really make that patient intake to check-in experience down to just a couple of minutes. And we built a lot more onto it, but that's what started it. And then similarly on the patient scheduling side, around the same time, 2005, 2006. In Tel Aviv, Israel, a couple by the name of Dikla and Ohad Ranan were expecting a child, and Dikla, the mom, had become increasingly frustrated with the amount of time she spent waiting on the phone trying to get her next appointment. And Ohad, who was a programmer technologist, said, you know what, I think I can automate that. And that sparked a company called Adoro, which now on the Israeli side, schedules nearly 50 million patient appointments annually. And Clearwave has acquired Adoro as of a couple of months ago, and now we've embedded that scheduling capability into our platform. So interesting sparks around the same time, halfway across the world, have led us to where we are today.
That's great. We're going to shift and talk a little bit about market momentum. Our industry is often criticized for being years behind. As you think about your solutions, why is now the right time for each of what you do? Are you driving the necessary industry change, or are you supporting a change already underway? Let's stick with Mike, and maybe Mike, you can talk about how your solution acts as a digital front door.
Well, thanks. And a lot of what we all do in a sense, in many cases, tends to solve obvious problems. And the way we look at it is that as a consumer, and especially in today's COVID age, we have scheduling capabilities, we have delivery capabilities, we have demand capabilities at our fingertips 24/7. And it's still amazing to us that in nearly 2021, with literally supercomputers in our hands and all of this consumer access to instant capability, that it doesn't exist in the healthcare continuum the way it should. And as consumers, we demand that. We know from our studies that 90% of patients are apt to abandon a provider who doesn't provide digital capabilities. And so, we believe as easy as it is to order, DoorDash or Uber Eats or or whatever, it ought to be that simple to schedule an appointment without having to pick up the phone or wait online or wait on hold and go through a really terrible experience. And so the time is absolutely now. And those are, just some of the capabilities that we're bringing to the market that A, make it much easier and much more convenient for the patient, and B, tremendously more efficient for the provider.
Gurmeet, what's your take on this?
Well, automation has been coming to healthcare slowly for a while, and I think we've been both part of that trend, and hopefully we're driving it forward. The other calculation that's relevant to us, although I agree with everything Mike just said, obviously creating great consumer experiences is where we locate ourselves. But we also locate ourselves in sort of, this patient's first idea, and which aligns better with value-based care. And when we started, we were trying to follow Wayne Gretzky's advice, skate to where the puck is going. Well, we got there, and the value-based care puck is still moving towards us in slow motion. Because the bulk of our health systems still, their revenue is fee-for-service. And so I'm quite hopeful that in reaction to this pandemic, we're going to see an acceleration towards value-based care. So that's another part of what I think is at a macroeconomic level that's quite relevant to us.
That's great. How about you, Yiding?
Oh, it's such a great question. We're a B2B company, and so we service healthcare providers, and we've just expanded to payers. And there's massive change in the healthcare, delivery engine. Although, fax is still the most common way that clinical documents are shared from one provider to another provider, or between a provider and payer. And so we're probably one of the last industries where fax is so mainstream. So it's a real mix, right? It's a real mix of both kind of trying to drive technology away from really what I hope is obsolete technology, but yet, we're working with far more connectivity of data and data interoperability than ever before. And so in that way, Virata Health is benefiting from all of that. It takes a village to really modernize such a large organization in a large market. We are, but where our focus has been squarely in improving the efficiency of a transaction. And we're building connections between providers and then across payers in a way that's never been done before. There's existing transactions that have been around for probably the last 15, 20 years, HL7, 270, X12 transactions, but they're fairly low adoption. And part of that is that the setup costs have been so high. And one of the core approaches has been, let's take that off of the providers to build. Let's build an entire platform where we are handling all those complex interactions. We're building and pulling in the payer rules. We're taking away that heavy lifting, and by doing that, we can actually streamline and get providers and payers back to what their core business is about. And that same philosophy is what we're taking now that we're part of Olive. And so that's a really exciting development for us. Just shortly before this announcement, Virata Health was acquired by Olive to help build the first ever end-to-end prior authorization platform from determination all the way to appeals. And what we see, and the joint philosophy here is when you remove administrative burden and increase efficiency, ultimately it's the consumer, it's the patient who wins, because they get to get their care faster. They're able to get that breast cancer treatment faster, or that knee replacement faster, and that's really what we're aimed to deliver.
Great.
Hey, Ryan, a question from one of our attendees today. Maybe it's directed, I think it's triggered by your comment, but also links, Mike, to yours around COVID-19. Maybe you can talk a little bit around kind of the provider sentiment in the way of, exploring and purchasing new innovative capabilities in this era right now, and maybe peg it to we're a year into the pandemic. So what is the appetite from your provider customers to explore new capabilities?
Was that directed at me?
If you're comfortable starting, why don't you take it, Kulmeet?
Yeah, so, there's a lot of pressure on providers, especially during the pandemic, to provide care for patients at home outside of we were doing this before, outside of the in-person encounter. And they haven't had great ways of doing this. It hasn't been part of their paradigm to really do that. And that has now gotten accelerated. And it's much more than the video visit. And in fact, one executive at a large health system said, a quote that stuck with us is that virtual care, the video visit is not virtual care. Everything that happens before and after the video visit is virtual care. And so, and there's a lot there, right? There's the prep, there's the engagement, there's connecting into devices. And so, we've seen, we've doubled this year largely because of that kind of realization from health systems. Our health system customers are under duress financially, and we notice them stepping back from certain kinds of purchases. I happen to be an investor in some healthcare, other digital health startups also, so I see that. But for those that are located in this virtual care world, it hasn't slowed down. It's only sped up.
Does anyone else have a take on that question from the audience?
Yeah, I'd be happy to chime in as well. At Clearwave, we work with nearly 400 specialty providers and health systems across the country, and in particular in the specialty provider space. It's hard to believe, but 60 to 70% of these providers are still largely manually collecting patient data, intake data, manually checking eligibility, processing payments in a really inefficient way. And what we found during COVID, it's only accelerated the need to automate those functions, make it safe for patients to check in, as an example. We did a lot of work around setting up virtual wait rooms and parking lot registration and zero contact registration, facilitating handoffs to telehealth, all of those things. And if anything, I think we've seen 2 years worth of adoption in the first 3 months of COVID. And it's a tremendous thing. It should have been happening anyway. It's a shame that a pandemic had to make this happen, but the good news is, from an efficiency and experience perspective, there's no going back. And we've experienced that similar kind of growth that Kulmeet just talked about as well.
Great, Dr. Yu, did you have something to add here?
Yeah, I think both Kulmeet and Mike have nailed it. And certainly on the virtual visit side, it is more important than ever, and we know that telemedicine taken off. But I think anything that is driving efficiency is being taken up by providers very avidly. And part of this is because they know that in 2021, you can't just go back to normal. You can't just go back and say, like, let's just do what we did in 2019. So many provider organizations are in a hole. They're looking to financially recover, and that means leapfrogging. And so it's not just saying, once people are back in the office, do we, still do virtual care or not? It is saying, wow, I need to dramatically improve my collections. I've dramatically improved my capacity. How am I, still handling these things like eligibility checks, prior authorization, claim statusing, all the things that are happening normally in the background that maybe a patient or consumer doesn't see, but it's critical to ensuring that your resources are, deployed to the right, provider-facing functions and revenue-generating functions. So we've seen a dramatic uptake both at Virata Health and at Olive in just this last year, with no slowdown, especially on the revenue cycle side.
Ken, could you maybe talk through how COVID-19 has affected SilverCloud's business?
Yeah, certainly. So SilverCloud is a digital mental health platform. We came into this year essentially with an existing sort of statistical backdrop that 1 in 4 of the global population will have a diagnosable mental health disorder, condition, or issue in any given year. Then you add in what happened and the impact of 2020 and COVID-19 on people's mental health. And I think it's been seen and even experienced by so many people, with well over 55% of people across the US reporting COVID-19 having negatively impacted their mental health. So what you're seeing is this huge acceleration across the US and indeed across Europe as well of a push and pull. So it kind of brings together the last two questions. It's that kind of sort of push piece from a clinician needing and requiring something more in their toolkit than a script pad in terms of being able to provide access, and a pull from the end users' requirements. They're looking for absolutely digital innovation, access to a method that is easier and earlier perhaps than what was there previously. And I think people have seen other industries step up in terms of virtual. People were mentioning there about sort of, contactless check-ins, and these various sort of other industries have stepped up, and, we're delivering something digital. So there's no reason why we can't mirror or map that. Efficiency delivery, absolutely from a clinician's perspective, but from the end user's perspective, they're looking for something that they can access that's more suitable to, I think, what they've become used to in the last year, or indeed what they've had to become used to, maybe with kids at home or hybrid schooling or whatever it might be. They need something that's significantly more virtual than what was there before. So to summarize, huge increase in terms of uptake and a huge acceleration from this area being of interest and being classified as innovation to this area being and SilverCloud being considered as a requirement, as a necessity, which is a huge progress. I'd say in 6-7 months, the US has probably moved forward nearly 10 years in terms of its adoption of digital mental health and digital behavioral health.
That's great. Dr. Yu mentioned earlier how Virata's solution works with both the health plan channel as well as the provider channel. Just sticking with you, Ken, you're a growing innovative company and there's a bunch of different channels by which you may deploy your solution. How do you prioritize between the payer, the provider, the direct-to-consumer, or other potential channels?
Yeah, I think we've kind of taken a slightly unique approach. I think, and it comes back to perhaps some of our history, whereby, we spun out from well over a decade of research into what we do. And that was involving academics, clinicians, and technologists across Europe and the US, and bringing together disparate people, groups like that, bringing them all together towards one shared goal or ambition or focus. I think we're applying that across our key segments of health plan, health system, and indeed, large employer. Whilst they look very separate on the surface, and indeed they often use different languages or language in terms of terminology, be it patient or versus employee versus member, for example. When you kind of go a couple of layers deep on it, you actually realize how interconnected each one of these organizations are. 54% of Americans receive their health coverage via their employer. Health systems are financially looking for methods and ways to enhance the offering that they have with maybe some of the large employers within their catchment or local area. The connection between the health plan themselves and the health systems. And we've brought together many of those groups in terms of reimbursement for SilverCloud, because you're able to demonstrate the impact and effectiveness. So what you can start to do is draw together a very interesting, very visible thread between the three segments. Our approach has been kind of squarely go after the health systems and indeed the plans, and that's allowed us really deliver with serious clinical weight through randomized controlled trials, real world delivery of over 500,000 users, patients or members, and use that expertise and then bring it into the sort of employer segment. So that was kind of our approach in terms of prioritization.
Great. We're going to shift gears and do a quick lightning round here. I'm going to ask the panelists to spend 60 seconds or less answering this question, which is, what does healthcare look like in a hopefully soon post-COVID-19 world? Maybe we'll start with you, Kulmeet.
Well, I think more will embrace value-based care, and technologies such as those represented on this panel, will just get accelerated more and more. And I think the pandemic has educated a lot of patients. I suspect you'll see more patients activated in their own care, caring about their own care and not just leaving it to the providers.
How about you, Dr. Yu?
I think, one of the things that strikes me most talking to my health system colleagues is that the pandemic has forced back office or administrative staff in hospital systems to work from home. And previously, everyone thought that was impossible. People would be unproductive. There's no ways, people have to be in the office. You have to have these, huge buildings with cubicles to manage and do all this stuff. What we're seeing is productivity is the same or even better with work from home. And several of my, the leaders that I'm speaking to, CEOs, COOs of hospitals and health systems, are saying, I don't think we're ever going to go back. And that is going to be a game changer for how we think about, using technologies and how health systems are delivering administrative work. And I think that's incredibly exciting because it means that we can get economies of scale. It means that we can start thinking about the operation of healthcare differently and get away from the walls and confines of a hospital or a building system and think more about how do we deliver care across the spectrum. And we're going to feel that not only financially in a health system, but also downstream as we are all consumers as patients. I think it's going to really leave incredible dividends.
How about you, Mike?
Yeah, we kind of see it in three ways. Number one, it's using and leveraging these various technologies to reduce the friction between patients and providers, all the way from finding providers, getting the right level of care, getting the access that patients want and need on their own time, their own schedules. Then number two, leveraging this technology on the provider side to become a whole lot more efficient and reduce the waste in practice administration, thereby freeing up time to focus on really what matters, which is patient care and outcomes. That's what we really see happening as a result of these technology instances.
Wrap up with you, Ken.
Yeah, I would kind of say I see next year as being kind of the year of collaboration, the year of partnerships. I think both in terms of digital health, the industry itself, we've seen some consolidation happen, but I think it's very early in and with regard to the percentage of actual patients who are getting access to digital interventions versus the need. So what I would see is, instead of that kind of continued trend next year, or being the forerunner, what we'll see more is a deepening of partnerships, a deepening of collaborations, a coming together and forging forward to sort of rise the digital health tide for all, before I think those those acquisitions and indeed consolidations that will happen will be 2022 and 2023. From a clinician's perspective, I think this past year has perhaps shown the collaboration piece, and collaborating with digital health is a good thing. It's a good thing for them. It's a good thing for patients. And it's not something to be feared. It's something to be embraced. And that, again, push-pull again. So I think, yeah, next year will be the year of that kind of partnership and collaboration. I think that's going to be the big theme.
Ken, I'm glad you brought up collaboration and partnership. We were pleased to learn over the last weeks that a couple of our companies represented by this panel are actually already either in partnership or considering partnership. Kulmeet, do you want to just riff off of what Ken just shared and talk about how Twistle is working with SilverCloud?
Yeah, so, I'll tell you a story, a quick story. This is prior to COVID, prior to our partnership that we're exploring with building with SilverCloud. We engage patients in major surgeries, getting them to stop their blood thinner on time, and getting them to do prehabilitation. And we're a fairly configurable platform. And one of our surgeons added a step on the eve of the surgery. The patient got a text message automatically that said, "Hey, get a good night's sleep. We got this tomorrow." when we collect outcomes, at the end from both the health system and from patients, and we found 74% of patients didn't remember any of the clinical content. They're like, my doc messaged me on the eve of my surgery. Well, technically, the doc didn't. We did it on behalf of the doc, but that was like one of the most memorable things for the patient. And that sort of leads you to realize empathy, mental health, behavioral health, the importance of this. And it's only gotten, during the pandemic, this has become even more important. It's during this pandemic that we reached out to Ken. We don't want to solve at Twistle problems that have already been solved. We've had pathways for depression and other behavioral health issues, but, Silver Cloud's the experts here in delivering, great ways to treat these patients virtually. And so it was a natural partnership. And, so that's it. We're also, by the way, exploring a partnership with Olive, Dr. Yu's new company, but that's very early in its stages.
Great. Mike and Dr. Yu, do you want to just talk through how Clearwave is also exploring partnerships with Virata and Olive?
Sure. Very similarly, we've got some large provider clients that are evaluating and looking at our scheduling tool as an example. And part of the thing that our scheduling tool does is it not only allows for patient self-scheduling, but it has a tremendous back office call center capability that really makes it much more efficient, on a large scale, provider environment to schedule patients. And so not only are we doing that and validating eligibility at the point of schedule, but we've had requests to say, hey, this is great, but we also have a big pain point around prior authorizations at the point of scheduling, and we have to spend a lot of time before we can actively schedule that patient. And so we've reached out to Dr. Yu and Jeremy at Virata, and we're just beginning discussions around how we could embed, the Virata service into that process, which we think is hugely promising and will be a great value add for our client.
I think it just, speaks to, Ken's point earlier, this collaboration, and that we're all out here to solve, at the end of the day, like the same thing. And we know that there's different strengths. Clearwave is clearly making huge improvements on scheduling and patient access, and that's a place that we overlap with. We don't solve the same issue, but we want to help Clearwave become even more effective. We actually have collaborations, Virata and Olive. We have collaborations across the industry. We started collaborating and delivering solutions to a pharmacy hub so that they can help doctors get prior authorizations more effectively, which is, was a totally different application of our initial technology, which focused on providers. And now at Olive, we've even built something called Olive Helps, which is a platform that assists providers right there on their computer with suggestions and kind of exactly just-in-time notifications or just-in-time advice. And we're starting an ecosystem where companies like Silver Cloud, Twistle, and Clearwave can create what we call loops or applications on the system, and then a provider organization can take advantage of an endless number of solutions and embed it within the workflows of their different health systems, and just have just-in-time notifications or just-in-time advice exactly when they need it. And we're just starting to roll that out this year. So I'm totally with Ken. I think this collaboration and building upon each other's technology is exactly where we're going to take it in the future.
Hey, Ryan, there are a couple of questions out there for the panelists all around this topic of kind of impact and efficacy. And I think in specific, there's a curiosity around how do you measure it and how do you think about the impact at both the individual and at a group level. And I think, you were all going to go there at some point. So whoever wants to go first, have at it.
If I could maybe start on it. The amazing thing, it's an amazing blessing for digital health companies, because we are digital. It means that we are infinitely measurable in terms of the impact of what we're delivering. And that provides an amazing opportunity, both in terms of to demonstrate as a first education of what we can do, but now I suppose as the market has begun to mature, it's now perhaps to differentiate against noise or competitors or even status quo. So yeah, I think it's probably one of the biggest impact factors in the next 24 months will be that demonstrating real outcomes. And I think we've seen it over the past 12 months, particularly that very rapid education around health systems, health plans, and even large self-insured corporate organizations. Their knowledge of what data is and data transparency has moved forward light years in terms of perhaps where it was of yesteryear. You know, they're using correct terminology around needing to see, you know, the patient-reported outcome is a validated measure itself, or they want to see impact in terms of a real-world setting rather than some laboratory setting that is, you know, only a certain age or demographic. So it's an incredible journey to chart that education and that movement forward, and an incredible opportunity as well for the really impactful digital health companies to be able to show what they do.
I'd like to, I mean, that's a great thing that Ken just, that we're very measurable. So prior to COVID, you know, we knew exactly these are the patients we engaged, what their engagement levels are, what their adoptions were, are we impacting readmissions, length of stay, surgical site infections, and everything was measurable. We deliver on a monthly basis an ROI against, you know, what's going on. And COVID was like this, it epitomized it in a short few months. We saw, you know, those results. So we've engaged about 1% of all positive COVID-19 patients in the country. 87% of those patients have been checking in at least once a day with our platform. Before we were deployed, about one nurse would manage about 25 COVID patients at home because they were using the phone or the patient portal, which isn't really doesn't have high engagement. Now one nurse is managing about 100 patients. And so we were doing this in surgery, in chronic disease. The measure, you know, COVID just measured it very, very, in a very concentrated way, because, you know, we're at, I think, 180,000 patients as of Monday. So hopefully that gives you some sense of metrics.
Yeah, at Clearwave, we also, you know, focus on you know, provider practice outcomes and the business side of how they're performing. And you know, some examples of that is that we get really high patient utilization in our practice clients. So, you know, well over 80% will interact with the platform. Our eligibility as a service engine will check and verify eligibility over 7 times per patient encounter, and that results in you know, an up to 90% reduction in denied claims, which is, you know, a huge profit leak for our practices. And the subsequent result of that is, you know, an increase in cash collections of, you know, up to 50 and upwards of 60%. And those are really, you know, especially in a world where practice revenues have been hit by, you know, 30+% during shutdowns and so forth. Those are really, you know, meaningful numbers that we focus on with frequency with our clients.
Yeah, and I'll just wrap up to say similarly, we're focused on the revenue cycle, and so our champions and folks who bring us into their organizations are incredibly financially focused. So we take measurement incredibly seriously, you know, both at Virata and at Olive, where we see, you know, a great deal of this. You start certainly whereas we're trying to and aiming to reduce the provider and their staff burden. So we certainly measure turnaround times. We measure, you know, how much more prior authorizations an individual could do, and we generally look at overall staffing needs. So can we, you know, unload about 25% of the work and just free up that staff, you know, to do other patient care facing functions, and that's generally the average that we see, about a hard number, about 25% of an FTE spend on this area can be diverted or adjusted to other areas and invested towards patient care. But I would say, like, more substantially, we talked about write-offs earlier on as being a substantial cost of loss in a health system. We've been able to show a 35% reduction on average across all of our clients in prior authorization related write-offs. And so if you save for like an average 300-bed hospital, that's $1 to $3 million a year of top line revenue back on your balance. And then what's been incredibly exciting is just that, yes, we're saving people's time. Yes, we're kind of preventing losses, which are all very important. But at the end of the day, you need to get patients in and you want to deliver them care. And we've been able to show that we're saving about 80%. We're shaving about 80% off the turnaround time. So you're, instead of waiting, say, 11 days on average for a health insurance company to come back with an approval response, we've gone, some of our clients down to 2.5 days total average. And that means they're filling those ORs, they're filling those CT scanners. One of our clients actually came out when we did a year-over-year analysis. This was before COVID, so the numbers were actually easy to work with, but they saw about on average a 15% increase in procedural revenue for every service line that implemented with prior authorization automation. So the numbers just made sense, and to the extent that now part of Olive's has evolved their entire business model, largely for at-risk contracts. So when we work with a health system, we guarantee a certain return on investment for your initial investment, and that's either at like a 3, 4, or 5x annual return on investment. And we do that because we're so confident that AI technology and automation can deliver those type of returns. And we'll make less if we don't deliver on it, but it really means we stand by our word and we stand by those measurements.
That's great. I like how you all talked about ways in which you're making a clinical impact, ways in which you're leading to higher patient satisfaction, and then importantly, taking costs out of the system. So great work on the impact that you're having in healthcare. The final topic that we'll talk about is just the future for each of your organizations. Would be curious to hear a quick snippet of what's the future of each of these organizations. Maybe we'll start with you, Kulmeet.
So on the product front, because of COVID, we are already connected into the patient oximeter to measure their blood saturation. We were doing this before COVID also with CPAP machines, but now we're just going to connect into a lot more devices for the remote physiologic or the remote patient monitoring while the patient's at home. So devices are going to be an important part of it. But what's more important is the data coming off of all these different sources. Historically, Twistle's conversations patterns were decided by smart doctors saying, look, this is what the conversation pattern should be, and they could configure it. But now we have so much data that we're using machine learning and other approaches for those pathways to change. And we've already started this year. We've been giving feedback to the clinicians. So we see more automation, more personalization, moving in this direction of sort of almost hyper-personalization for patients. That's sort of where we're going. And then we continue to see partnerships with, SilverCloud and other companies. Again, as I said, we don't want to solve problems that have already been solved. So we expect, maybe late next year, we might even start looking at some M&A. And so from a growth perspective, that's another part of the business strategy.
That's great. Dr. Yu, you've mentioned the Olive combination. If you can just share briefly what was the vision for putting those two companies together.
Oh, thank you. So, to this point, we of partnerships, we started working with Olive early, late spring this year as a partner. They were an automation AI company that was looking to deliver to their clients a way to submit prior authorizations and handle all those complex clinical documents and rules in a way that they, had not yet developed. They weren't looking to solve and build this themselves. And so they brought in Virata as their exclusive partner. And so we worked over the last couple of months delivering our solution to their clients. And it was such a natural fit, both cultural fit as well as just a solution fit, that we realized that a 1 + 1 was more than 2, that we could deliver something that was pretty unprecedented. They were developing technologies that we were now focused on, and we had something that was truly unique in the marketplace. And so it came together as something very exciting. And now that we are, one company, Olive is taking advantage of what we've done with our payers. So we've just, we've been reaching out and having partnerships with some payers that are on the relatively early side, because we focused on delivering our provider solution first. But when you're able to solve both sides of the fax machine, right? When you cut out all that noise and you're able to make direct connections between a provider and payer, you can do better than 2.5 days. You can do it in minutes. And so that's what we've started to deliver. We've just gone live with a payer just this past weekend, delivering point of care authorizations for their providers in that state. It's just game changing to be able to do that. And we're so excited now at Olive to be able to take that technology and the whole entire Olive and Virata suite to the payer market and say, how can we, just like we're eliminating waste and inefficiency from providers, how can we do the same for payers who are also looking to become more competitive, in this new market?
How about you, Ken, at SilverCloud?
Yeah, I think as the digital front door for mental health, what we want to focus on is more impact, easier and earlier access, deeper outcomes and validation. So, we'll continue, increasing the sort of pathways with deeper and further integration with electronic health record systems, billing engines, etc. Further program development across a number of chronic disease areas and even pediatric areas in terms of mental health. Deepening our partnerships, as was mentioned by other panelists. Some of the work we're doing with Microsoft on machine learning and AI, some incredible results over the past 2.5 years with them. Really with the kind of backdrop of the goal of getting SilverCloud into as many people's hands as possible to help improve their mental health. So as long as we stay focused on that and focus on outcomes being our North Star, it'll be a busy but a very fruitful new year.
That's great. Let's wrap with Mike.
Hey, thanks. We're really excited, for this next chapter. In the short term, we're very busy integrating our acquisition of patient access and self-scheduling with Adoro and bringing that to the market really as we speak, and evolving our footprint in terms of what we can provide our practice clients. And then moving on from there, we see some tremendous opportunities to evolve into more of a true patient management solution, more end-to-end in terms of that patient continuum. And so things that happen, Colmeet had mentioned this before, virtual care is not really the point of consult, it's all the things that happen before and after. And we see many opportunities to broaden our platform post-visit in terms of better patient communications, adherence, monitoring, and those types of applications, which is where we see some real growth for us as well.
Well, wonderful. That concludes our panel discussion. Thank you all for your time. Thank you for our listeners, and congratulations to SilverCloud, Clearwave, Virata, and Twistle on being the TripleTree 2020 iAwards winners. I will now hand it back over to Michael Carroll to wrap up here.
I'll add my thanks to all the panelists, and I'll add my thanks to everyone who's listened to Market Insights Live over the last few weeks and months. We hope you found the sessions engaging and insightful. As Ryan mentioned earlier, this is our final Market Insights Live session of 2020. We will be back in 2021, so stay tuned for more information. In the meantime, if you're curious to watch any of the replays from our 8 sessions, you can visit triple-tree.com/Market Insights Live. You can also find podcasts on your favorite podcast source. On behalf of everyone here at TripleTree and TT Capital Partners, thanks again for joining today. We wish you a very happy holidays and a healthy and successful 2021. Thank you.